Now here's our reporter Laura Windsor with more on tummy time.
According to the American Academy of Pediatrics, the safest position for your baby for sleeping is on their back. So what is infant tummy time? We spoke with physical therapist Cathy Premysler at Children's Hospital of Orange County and asked her to explain tummy time.
Tummy time is a position that we place infants on their bellies to help encourage strengthening of the head and neck muscles. Tummy time should be a part of a baby's daily routine. It should be done as frequently as possible during waking hours only. Tummy time should definitely be supervised, and as long as there's no medical contraindications, it should be done as many times throughout the day. The duration of tummy time, generally we say work up to 10 minutes. Now obviously a newborn is not going to be able to hold their head up for 10 minutes. So generally we say 6 to 8 sessions of tummy time throughout your day, working up to the 10 minutes. And for an infant 0 to 2 months old, we want to begin with just 1 to 2 minutes at each session and work your way up to the 10 minutes.
What part of the body does tummy time strengthen, and why do these areas need strengthening?
The tummy time highlights strengthening the trunk and the head and neck muscles. We need this so that the baby can start exploring their environment visually and starting to explore with different movements. As the baby gets older in age, beyond 6 months of age, we want to make sure that the baby can hold their head up with nice head control against the gravity in order to prepare for larger movements such as crawling, such as independent sitting, such as transitioning up into a sitting position.
Why do some babies not like tummy time?
It's hard. They have to work against the gravity now. They have to start learning how to pick up their head, and they're working double time. Some babies can have some reflux or some GI issues, which will make them uncomfortable in that position. Parents are always encouraged to be creative. So for instance, doing it on a parent's body will really help the baby feel more comforted. Also using a boppy pillow, which is a U-shaped pillow that kind of just adds a little bit of extra support, or parents can use a towel roll to put that underneath the baby's chest. That will also help the baby a little bit more to work a little bit less in the position. Consistency is key. So again, we try to encourage frequent sessions throughout the day. I would say if a parent starts this initially as a newborn and incorporates this throughout a baby's day, generally by 2 months of age, the baby should be able to hold their head against the gravity. So as a newborn, you bring home your baby, you put your baby on their tummy time, they're not lifting their head. They're resting their head to their side slightly on either cheek. As they gain some strength in their neck and head and neck muscles, you'll see them bobbing their head just slightly up against the surface, even if it's slightly from turning their head from one cheek to the next. As they get stronger and more mature in age, you will see them propping on their forearms with a nice long neck, eventually pressing up on their arms with a nice long neck to prepare for independent crawling.
Tummy time helps the baby with both fine and gross motor development and strengthens the muscles of the neck and upper back. For the American Health Journal, I'm Laura Windsor.